All right, let's begin with our first big story. Health workers are worried about the confirmation of 2 cases of polio virus in northern state of Borno in Nigeria.
But the UNICEF says the 2 new cases underline the prevailing risks children encounter in conflict zones.
Nigeria is one of 3 countries worldwide, coming next to Pakistan and Afghanistan, where polio is considered endemic. 6 confirmed polio cases were recorded in 2 states in 2014, and the previous year 53 cases in 9 states. The last case was discovered in Kano in July 2014. These experts are gathered here to celebrate a milestone achievement, conquering a dreaded disease that affects children and babies.
The activities we've done so far this year in terms of our surveillance, taking after the children, ensuring that they get the vaccination must be intensified. This country took care of Ebola by doing an aggressive monitoring of cases. We need to do that. Aggressive vaccination of our children. That's what is going to get us free of polio.
Over the years, they had tried to find measures of making sure that children are protected from the disease at birth. They had also continually made efforts to ensure that every young child gets immunized. Surveillance and routine checks and tracking of newborns is still necessary if Nigeria is to attain the World Health Organization free status in the next 3 to 5 years.
Despite the progress we've made, we're not yet out. We need to keep on accelerating the pedal in such a way that we should not relax. We should not rest on our oar until we see the last case of polio virus. So far, 6 months without a case, but we should not sleep until we've attained certification 3 years later.
We need to continue motivating all the community workers, the traditional leaders, the politicians, to continue our efforts, because the goal is possible and collectively we have made great progress. We just need to continue doing more of all the good work that we have been doing in the past years.
In 2014, there were only 350 confirmed cases in the world, coming down from more than 300,000 a year when the Global Eradication Program began in 1988. And with an 87% reduction in cases of the virus in children in Nigeria, these experts are hoping that the insurgency-prone areas and states will not have a new case anytime soon. Kemi Balogun, TVC News Nigeria, Abuja.
All right, we're joined now by a public health physician, Dr. Olalikon Makinde. Thanks for joining us this morning.
Thank you very much.
Good morning.
Good morning.
All right, now let's start it this way. When it comes to polio, we often hear polio and then we see persons who, in societal terms, they call them disabled people, as the case may be. Now, let's come down to the foundation, understanding what polio is and what is the virus, or if it is a bacteria, whatever it's called. Make us understand what polio is.
Okay, basically you have the polio virus, and the virus usually infects children between the age of 0 and 15. Okay. And one thing about polio is that it's not every child that is infected that comes down with acute flaccid paralysis. So in the case of Borno, that we are seeing 2 children coming down, that means there are many other children that have the virus. Because when somebody gets infected with the polio virus, you might either not show any symptoms, so it could resolve on its own. It could show some mild, maybe fever-like symptoms, flu-like symptoms, and it resolves. It could go as far as making the child sicker, and in the worst scenario, it causes what we call the acute flaccid paralysis, which is what we see to be able to know that this child has have the worst of polio. So it's a spectrum. So it's not every child that gets infected that will show acute flaccid paralysis. So what we've seen now implies that there have been cases of this infection that were undetected in those parts of Borno State.
Okay. Now, in understanding this better, we'll come to all that. Let's give our viewers a perspective to this too. Now, poliomyelitis, often called polio or infantile paralysis, is an infection caused by a virus. Now, it invades the nervous system and can cause total paralysis.
The virus is transmitted from person to person, spread mainly through infected fecal matters entering the mouth or by contaminated water, food, and less commonly from infected saliva.
Now, polio mainly affects children under 5 years of age. It is preventable with many doses of the vaccine. Our doctor just mentioned that in the house earlier on, talking about age 0 to about 5. Now, according to the World Health Organization, polio cases have decreased by over 99% since 1988, from an estimated 350,000 cases then to 74 reported cases in 2015.
The reduction is the result of the global effort to eradicate the disease, leaving it spreading between people in Afghanistan, Nigeria, and Pakistan. Nigeria made appreciable progress in polio eradication from 1998 to 2002, but suffered a major setback in 2003 as a result of controversy over the safety of the oral polio vaccine. As the polio campaign intensified, a host of rumors sprang up that the immunization effort could cause sterility and spread the HIV virus.
Now, this dealt a severe blow to global polio eradication efforts. The turning point for Nigeria came in 2014 with only 6 polio cases recorded in the north compared to the 53 recorded in the previous year. Now, once 3 years have passed without a case of polio, WHO will certify polio eradicated in the region.
With concerted efforts by the government and other concerned individuals, Nigeria was removed from the list of polio endemic countries in September 2015 and was to be certified polio-free on July 24, 2017. This was a major victory for the nation's polio eradication effort, as it was the first time that Nigeria interrupted the transmission of the wild polio virus, bringing the country and Africa closer to being certified polio-free.
Right now, Africa would have marked 2 years without a case of polio on August 11, 2016, as the last case was diagnosed on August 11, 2014 in Somalia. Ironically, health officials announced the same day that 2 children have the disease in Borno State. Now, what this means is that the certification will start all over again, and if Nigeria made it without a case for a 3rd year, WHO would have certified Nigeria and Africa polio-free. Now, let's understand Nigeria, Afghanistan, and Pakistan. When it comes to ratings of either sanitation or poverty indexes, or Nigeria and these countries are not the least, as the case may be. But what's peculiar about these 3 countries that they are still the ones having polio over the years?
Well, if you look at the countries, look about the issue of violence in those countries. And in 2012, we knew that Nigeria have more than half of the cases. Nigeria had about 122 cases, while these 2 countries together had less than 100. So we can look at the main thing that we can link to all this is violence. And in Nigeria, case of Boko Haram, and people could not get to those areas in the northeast. So that's one major issue that we have to look at when we come to those 3 countries. But people always say, as everybody can see already, Nigeria should not be classified with countries like Pakistan and Afghanistan. So it's something to really worry about. You know, India was part of us before. We have 4 countries before, which we call the pain country: Pakistan, Afghanistan, India, and Nigeria. But India was satisfied polio-free because they attained their own 3 years without a case of polio, and now they are off the hook. So Nigeria have to start all over again, and we have to really address the situation at hand so that we can be able to get this off. And you know, the thing about polio is this: an injury to one is an injury to all. If it's in a nation and it's not combated, it's going to get to other nations. What we're about. You know, India was part of us before. We have 4 countries before, which we call the pain country: Pakistan, Afghanistan, India, and Nigeria. But India was satisfied polio-free because they attained their own 3 years without a case of polio, and now they are off the hook. So Nigeria have to start all over again, and we have to really address the situation at hand so that we can be able to get this off. And you know, the thing about polio is this: an injury to one is an injury to all. If it's in a nation and it's not combated, it's going to get to other nations. And that's why at the moment, everybody is here. UNICEF, WHO, what we call the initiative that was formed in 1988, the Global Polio Eradication Initiative, is on ground to make sure that things are being done today to make sure that this issue is nipped in the bud before it gets out of hand.
Is this even not more so where you have countries like Chad, Cameroon also affected and being plagued by the Boko Haram menace, and the IDP people move from Nigeria to Chad to Cameroon, and from Cameroon to Chad to Nigeria?
And that's why we have to increase our surveillance, because if care is not taken, those countries are going to get cases too. very soon we'll start having cases in Niger, Chad, and co, because people migrate easily from all this part of the north to all those countries. And that's why everybody in the world is now looking at Nigeria. We have to do something together, and everybody is coming together to make sure that we be able to deal with this issue of polio in Borno State.
Okay, let's actually just go back to this particular cases we have in Borno. From the report we have, this is a type 1 polio virus. Is that correct?
The wild polio virus 1. You know, before we used to talk about 1 and 3. 3 has been eradicated, but what we are talking about now, which is the main problem in the world today, is the type 1, which is what we've gotten in Borno. I know that this is a very important type that we need to deal with, because this type usually is one that really presents, most of the people that get infected present with the acute flaccid paralysis that we've seen in those children that we're seeing in those states.
But what's the difference between the type 1 and type 2 and type 3 and as the different types as the case?
Yes, the difference is each of the types has its own, when it comes to viruses, they have their own shape and the way they operate. So the difference between, just like HIV, you have HIV type 1, type 2. There's some nation where you can say type 1, you say type 2. So if you have to deal with those diseases, you have to know the type you are dealing with, because you have to really attack that particular type. So talking about the polio virus, although the polio vaccine is actually, before we are dealing with trivalent, which has the type 1, type 2, type 3. But now we are dealing with the bivalent, which has the type 1 and type 3. Even though we have eradicated type 3, we don't want to take chances. So the vaccine that is being given today has both against for the type 1 and the type 3. But the major issue we are having today is by the type 1. So each of those viruses has their own type. If you give a vaccine against a type 2 and there is a type 1, then you've done nothing. So that's why the viruses are typed, to be able to know how to be able to attack them and then to be able to deal with them. That's why. All
right, talking about vaccine, and the UNICEF and all the organizations are on ground to go ahead with this vaccination. But tell us what could be challenges in this area, in the area of tracking of vaccines. Perhaps some of those children have gotten vaccines before. Do we have record? Can they track them? Are we going to have a case of overdose, underdose?
No, you just go on and vaccinate a child. You know, the risk of not vaccinating is more than the risk of vaccinating more than once or twice. And polio virus can be given even more than once. So every child...
The dose, you have to take it 4 times.
Yes.
Yeah, so if it's more than 4 times, won't there be a problem?
No, we can give more than 4 times. That's why we have all kind of vaccination, because you really don't want to miss any child. You don't want the child not to have the vaccine. So you can give more than 4 times if, because you look at the pros and cons, and you look at, okay, if I don't give, there are more dangers than if I give and I give more. So we are going to give all the children. That's the way to go at this moment, because we don't want to miss out any child. And there's what we call herd immunity. Okay, because when the people in the place, a lot of people, maybe 80% or 90% have been vaccinated. There is a kind of immunity that you confer even on other children. So we call it herd immunity in this case. So that also is one of the things we want to back on in this approach to dealing with the polio issues.
All right. Now, in a scenario where there has just been a detection in a child, if it's early, if it's detected earlier, can it be corrected?
Yes.
That's why vaccination is just the way to go. Because if the child has it, like I said, some children will get the polio virus and they will show no symptoms at all, nothing, no headache, no fever, nothing. And some children will have get infected and they will just show some mild symptoms. So it's a spectrum, and you cannot determine what a child will come down with, getting the virus. So it's just like everybody gets infected with the malaria parasite and they show varied symptoms. So that's what we have also in polio. You cannot predetermine who will come down with acute flaccid paralysis or who will not. And that's why there have to be active surveillance on ground to be able to detect these viruses before we have all these damages being done to the children.
Yeah, but really the question is, if a child is already infected and the child is vaccinated, can it be reversed? Can it be cured?
Vaccination usually is to be done before the child is infected. And that's why we have to vaccinate. If you remember that in the EPI, the polio vaccine is given even from birth. So that's why you don't want to give the chance. So from birth, you start the vaccination. Birth, 6 weeks, 10 weeks, 14 weeks. You want to do the vaccination before the child gets exposed to the virus. Prevention is always better than cure, which is one thing we have to do. You have to know the major problem in this case is basically the insurgency. I have to say that the health workers have done great work. You can remember that people were even killed. They paid the ultimate price trying to get people vaccinated. So, but once people could not get access to this vaccine, that was problem. And I saw in the news now that even the vaccination going, there was a clause that only places that are accessible the children from places that are accessible will be vaccinated, and that's also an issue now. So we need the security people to be able to clear off enough places that we can get more people vaccinated. So we cannot work alone as health worker now without having security backup in this case. Yeah. So this is important.
All right. When we talk about the issue of violent-prone areas, Nigeria is not the only country with the issue of violence. We've had issues in Mali, issues in Somalia, Central African Republic, Congo, South Sudan, and so on. What is the likelihood that those cases can also have the virus of polio, the polio virus?
Yeah, those cases can have it. But in Nigeria, you must remember Nigeria is highly populated. So we are peculiar in so many ways. In those countries, maybe you can have few people in few places, but in Nigeria, in any small place, we have a lot of people there. So that's one thing. Population is a major issue for us. It is said that we are maybe 1/5 of the whole African nation, or even more than that. So other countries might not get the kind of thing we get because most of them are just few people in the nation. But here you have so many people. The Sambisa Africa is said to be bigger than some nations in Africa. So you can imagine what is happening there. So these are the issues. Once we cannot get access to the children and they are not getting the vaccines, then the problem continues. But I just believe at this moment that we'll be able to do more work. We have the whole world coming to Nigeria in a way. Everybody lending their support and be able to nip this in the bud. Because if you don't, everybody's at risk. So nobody's safe. If you don't get it off Nigeria, Nigeria travels a lot. So before you know it, from here, it gets to the next nation. It gets all over the world again. So we are back to square one. So everybody needs to help out because helping Nigeria now means helping yourself.
So you mean the virus can even travel with adults?
Yes, because we said it's more in children between 0 and 5, but it can as much as children to the age of 15. Yeah, it can still show symptoms of
to the age of 15, yes. You can have the residual or
yes,
how?
And it's
just being a carrier.
Yes, just being a carrier till the age of 15.
Yes, to the age of 15. So they can take it from here to other nations. Children travel also.
Yes, they do.
Yeah, so it can be given to other people while they travel, and that and it's fake aura, just like you have said during the. So once somebody has it and somebody else gets it, it's spread, and that's it.
And the vaccine, does it just come in one form for areas where they might not be able to reach them? Can they drop like a kind of, I don't know, I'm just thinking aloud.
It is called oral polio vaccine.
Yes.
It's given through the mouth. That's the one we use here. Also, we have the IPV, which is given by injection. So we don't have the technology for just spraying vaccine yet. And we don't want everybody to get vaccinated when you don't need it. So it has to be given specifically to the people that need it. And these are majorly children in this case.
And so what happens to those places where perhaps the health workers can't get to?
That's where we are now. So that is why we said the security people need to come in. And that's why health is more than just talking about health workers. We have to have everybody on board. There have to be intersectorial collaboration, which is one of the tenets of the primary health care. So at this point in time, the health worker cannot do everything. We need the support from the security agent to be able to reach out to places unreachable at the moment.
All right, we know that generally many Nigerians, there has been complaint, many Nigerians don't go to hospital for checkup and things like that. 2 cases have just been detected. How likely is it that there are so many other cases that have not been reported or detected in the villages and rural areas?
Of course, I've told you already, there's what called the iceberg effect, even in health. Once you've seen 2, maybe about 100 you've not seen. So everybody knows that. Everybody that is knowledgeable about health, public health, knows that already. And that's why I say everybody is geared up to start to do something. So once you've detected 2 cases of acid flaccid paralysis, because before you can have a case of AFP, you've had hundreds of cases that have gone undetected. So that's already that's already showed the fact that we have more people carrying the virus.
Right.
We know that already without being a magician.
Okay, so really the focus shouldn't just be Borno State alone now. The focus should be the whole of the country. If
you've seen the effort that's being made, it's being made in some of the other states. It's not just Borno that is being targeted. You have to target all the adjoining states. And if you can do that on time, we can get it done. And if you can be able to catch everybody there before, people travel a lot, but if you can start on time and we get things done. But the good thing about other states is the other states that already have many of the children vaccinated, there's already an herd immunity. So that also will do some protection against maybe somebody just introducing it to the states.
All right, let's talk about the health budget for this year. What we have, does it really help matters when you're talking of cases of vaccination and re-emergence of polio?
Everybody knows that's the problem in Nigeria at the moment. We have the 2001, the African nation met, and everybody decided, okay, we're going to have 50% of our budget to health. And the decision was made, in fact, it's called the Abuja Declaration. It was made in Nigeria. But today, alas, we have our budget just about 3.something% is towards health. We know that health is underfunded in Nigeria. That is something that is clear to everybody. And you need to see what is happening on ground. Sometimes when you get into the hospital, you are so discouraged because you see the things, people need to work, they're not there. Some health workers have gone on strike recently because they don't have enough things to work with, and they've been shouting about this. So there's underfunding. I remember that also we have a case of corruption. If you remember, some of the donors have complained to the president about fund being misappropriated, which led to maybe some of the decisions the president made. So we have all these things with us. Underfunding is there, corruption is there, and these are the things we have to deal with, because it's also possible for somebody to take a contract to go and vaccinate children, and you give the person all the money funding needs, and he just went sitting somewhere else and then giving a report he had vaccinated 5,000 and he has not done it. So we have to deal with our systemic issues, and one of the major things we have here is the systemic decay. So if we can deal with that, and we have people doing what they need to do, then we'll be there in the long run.
All right. In general terms, what implications does this have on the image of Nigeria when it comes to health issues from viewing Nigeria from the outside world?
Well, the image has always been there. It's been a better one for us before, because in 2012 we started with about 120 cases, but by 2014 we'll be able to have our last case. So we've had a good image until this present issue came forth. We've had a good image. We were able to tackle it from 122 to 0 in 2014. So everybody knows the Boko Haram issue is on ground. So in a way, looking at it holistically, you cannot blame the Nigerian system in a way for this. You have to know that there was an issue that was beyond us, which we needed everyone to come on ground to deal with. So once we can be able to get this done, and then we'll be good to go. So it's not, it could have given us some bad image, but it's not really our fault to a good extent. It's just a fault of insecurity, which we know that there's insurgency all over the world. And that's.
So you just made mention of corruption, and are those not self-inflicted faults?
Yeah, those are some of our fault too. But in this case, it's not the primary issue. In this case, the primary issue is insecurity, even though those are secondary or tertiary issue to the case at hand.
Okay. Dr. Olalekan Makinde, public health physician, thank you for talking to us on TVC Breakfast.
Thank you. Pleasure is mine.
Thank you.
Thank you.
Right, we're going out on TVC Entertainment, but viewers there can continue with TVC Breakfast on TVC Nigeria, Concert Channel 190, DSTV Channel 418.
GoTV 45, ACTV, it is still 510. Let's continue the discussion there.